Joining us today. My name is Leanne Ganser, and I'm a Dell Health Scholar here at the Michael and Susan Dell Center for Healthy Living. And today I'll be talking about recruitment and engagement for school-based health research, perspectives from administration, teachers, and parents. The vision of the Michael and Susan Dell Center for Healthy Living is healthy children in a healthy world. And we do this by cutting-edge research, innovative community-based programs, and dissemination of evidence-based practices. As a part of this vision and mission, we undertook a study last year to assess some of the perspectives of parents, teachers, and administration of schools about how we do research and how we can better recruit and engage participants for our research. A little bit of background. School-based health research provides an important opportunity to improve the health of children and families. 50.7 million children attend public schools in the U.S., and using schools as a context for health promotion can provide supportive environments for health promoting behaviors through the use of a captive audience of students. There are classrooms for interventions and also trained teachers to facilitate implementation. Effective recruitment and engagement requires multi-level strategies to ensure buy-in and participation. There are many different stakeholders that need to be involved before effective school-based research can occur. Each school district has their own process, so you need to recruit the school districts. Many school districts, you also have to get the buy-in and approval of each individual school. If teachers are being used to implement the intervention, you also need to recruit teachers. And finally, because children are many times the priority population for these interventions, you also need the consent of parents, and which requires recruitment of parents and children. There are many challenges in school-based research, often obtaining a sufficient sample size for statistical power, and also adequately representing a school's population. There has been little previous research looking at effective strategies for recruitment and engagement. There have been several studies that have evaluated recruitment rates, looking at various recruitment and communication strategies, but there haven't been any studies that have qualitatively assessed the perspectives of all stakeholders involved in school-based research. So the purpose of this qualitative study was to understand the preferences, attitudes, and priorities of school administrators, teachers, and parents regarding child health research in schools. For this study, 5 out of 6 school districts in the Central Texas region agreed to participate in our qualitative study. Communication was attempted with 50 schools within those districts for a total participation rate of 44%. 4 schools declined to participate, either because they were too busy or uninterested, with the remaining non-participating schools being non-responsive. So in the end, we had 47 participants, 12 teachers, 10 administrators, and 25 parents. We also had several of these participants who completed both the survey and either an interview or a focus group. So we had 2 parent focus groups in Spanish and 1 administrator focus group in English, and the rest of the participants were interviewed using a semi-structured interview guide. So the data for this, we had both an online survey and a qualitative interview. The online survey for demographics looked at quantitative measures of participation in health programs, incentives, and preferred communication methods. The semi-structured interview guide was developed using the social cognitive theory, and our average interview time was 32 minutes. So these are some of the constructs that we looked at in our semi-structured interview guide. We looked at participants' knowledge of existing programs and research. We looked at knowledge of the recruitment process. This was for the teachers and administrators. We also looked at parent outcome expectations, so looking at what they thought the value of participating in research is. Then we also looked at barriers and facilitators to participation for teachers, districts, and parents. We also asked about reinforcements or incentives that would increase the likelihood of participation in research or a health program. And also, the Michael and Susan Dell Center for Healthy Living was also interested in what our participants thought about priorities that the center should have over the next 10 years in regards to child health. Just a little bit about our protocol. We had IRB approval, district approval, and principal approval for our research. We emailed or called our school contacts, and then if they agreed to participate, we would send the online survey link and schedule the interview. Then before the interview, we would review the online survey results, send reminders, and also send the questions ahead for them to review. All of our audio recordings were transcribed and verified for accuracy. Our Spanish language audio recordings were transcribed, translated into English, and then also verified by a second person. 2 of the authors coded the transcripts using NVivo. 50% of the transcripts were double coded, leading to 89% agreement, and the rest were single coded. To analyze our data, we used the framework approach. So the first step is familiarizing both coders with the data. So this includes reading through the transcripts and identifying initial themes. Then we also had a theoretical framework of recurring themes. Then we assigned data to the themes and the categories in the coding index. Finally, we summarized and interpreted. So we looked at similarities, differences, and associations in the data. We also refined and combined some of our initial themes. And then finally, interpreting, we developed more abstract concepts, searching for patterns, and then finally revisiting the original transcripts to ensure accurate interpretation of our data. Now for some results. These are the demographics of our parents who were included in our focus groups and interviews. All participants who were parents were female. However, also 100% of these participants said that they were the main caretaker of the children in their household. We had 84% of our parent participants were Hispanic. And then we also have a breakdown of the type of assistance received, showing that 32% qualified for free and reduced school meals, and 13, which is 52%, had received WIC care, showing that we were talking to some of our priority population of low-income parents. So some of our barriers and facilitators that came about from the parents. Some of the barriers to participating in health research included childcare, lack of childcare, lack of time, lack of mobility, language, because many of these parents were Spanish speaking, lack of resources, and transportation. One mother said, sometimes there are mothers that have younger children. If it was a family place, it would be perfect because many of us don't have someone to take care of them, and then it would be a large barrier. Similarly, some facilitators that were mentioned by the parents included providing childcare, providing food, having fun activities, having a family focus, and also timing after school was mentioned as a good time for some of the health-related programs. So outcome expectations from the parents. The 2 biggest themes that emerged from this were the benefit health of child and family, and also benefit for the wider community. So some parents said that when asked about what do they see as a benefit of participating in health research, said more than anything, information that the kids receive. That is the most important, since I tell them, but they don't believe me. It benefits them to know this information. And also many parents relayed that knowing that there's a benefit for the wider community and that this information would go beyond just their family was also important to them. We also asked parents about what were the most effective communication strategies. And parents mentioned the need for multiple avenues of communication to get health-related information or information about research in the schools. They mentioned that over the phone, signs, in person, social media, letters, email, and print were some of the main ways that they get information. But they also said that, for example, I know my kids do bring home flyers from school, but sometimes the school isn't always good about getting that to us. There's kind of a window of opportunity. If they send it too far in advance, people forget, or if they send it, we'll get it the same day it's happening and forget it. We can't get it into our schedules. And this sentiment was echoed by many parents, saying that there's need for a bit of redundancy to ensure that they get the information. When asked about what would make it more likely for them to participate in health-related research or have their child participate, many parents mentioned that having a health-related incentive would increase their likelihood. For example, one parent said, if we're going to teach them to try and exercise more, then how much is a yoga mat? Here you go. This is what we're going to teach you today. Here's a yoga mat. Thanks for coming. Many also said that gift cards, other educational flyers or certificates. There were also several parents that said that no incentive was needed, that just the benefit of going, especially if it was a fun, family-focused program, that no incentive was needed. Now moving on to the administration and teacher demographics. 95% were female. We had 25% Hispanic, 60% white, and 25% African American. 57% of the participants were teachers, and 9% or 42%. Sorry, those numbers are a little off. We had 9 district level administration. Many were very experienced and had more than 10 years of experience working in education. So some barriers to having teacher participation in health-related research. The most common answer was having competing priorities, not enough time, it's not their job, and testing, which also falls in with competing priorities. One administrator said they have so many things on their plates, convincing them that academics is not all we need to do right now. We need to focus on their health. Some facilitators to teacher participation included providing classroom supplies, finding teachers who were passionate about health, providing cash, and also short and simple lessons. For example, one teacher said, it should be simplistic enough that the teachers don't have to do a lot of thinking. It's pushing a button and the kids are listening to it, or it's a prompt that they just put up and the kids are writing about it. When asked about what effective communication strategies were with teachers, the most common answer was through email or staff meetings. There was some differences in this regard, whereas some people thought that staff meetings were the way to go. One teacher said, I think the best way to go to a teacher is to go to meetings. There are days we have to stay there for teachers' faculty meetings. When you send emails, they see it, and a lot of them just delete it. However, there were also teachers and administrators that said by far email. Teachers are living and breathing by their email. Not everybody, even our teachers within our department, don't do a good job of checking email, but that's going to be the best method. So similar to parents, redundancy and going through multiple channels would be an effective strategy. When asked about barriers for schools to participate in health-related research, the most common themes were teacher turnover, insufficient staff, competing priorities, testing, and also research fatigue. One administrator said, help principals understand how these programs help lead to improved academics overall. They're so focused on the academics, and so they don't see a connection. Just helping them clearly understand how this is going to help the child long term. Many teachers and administrators focused on this connection between academics and health, and including that type of messaging as you're recruiting schools and principals is really important. Facilitators to participating in health-related research included identifying key staff at the school, which is not always necessarily the principals, also providing free materials, incentives, reporting back to the schools after the research is done was a very important concept that many, especially the district administrators, told us, and because they said many times researchers come in, they do their research, and then they leave, and they don't continue to engage with the school and provide the results of the research. Also, knowing the processes and relationships. One district administrator said, keep schools engaged. The principal has to be involved in the original process. And this was a theme that came up multiple times when we had district administrators saying that they need to be involved from the start of the research because it makes it easier to have school and district buy-in. And we also asked, especially the district administration, about strategies for sustainability. Two main themes emerged regarding sustainability and long-term partnerships. Collaborative partnership was one concept that was mentioned. This theme encompassed communication, including districts early in planning, engaging with the schools outside of grant work, planning in advance for grants, community involvement in school health advisory councils, or SHACs, parent involvement, teacher buy-in, and working with student wellness teams. Stakeholders had a variety of ideas for how to make programs sustainable, including simplicity, giving schools a break between research projects, training staff, and making sure programs are evidence-based. One administrator said, "I think it'd be great if we could all come together and meet to talk about needs, gaps, challenges, and how we can work as a team as opposed to working in silos." So some of the conclusions for our parent-level recruitment and engagement, barriers for parents and children to participation in school-based research. Our findings were similar to previous evidence in showing that there's a need for convenient timing and inexpensive health promotion programs for children and parents through the school. Many parents in the study said that no incentive was necessary. This echoes results from a study on physical activity interventions with children in which parents cited social and educational benefits, as well as perceived health outcomes as being sufficient. Interventions should also strive to make children enthusiastic about the project by making activities fun and materials visually appealing. This was something that parents mentioned often in helping to participate in health-based research. At the school level, the main barrier was competing priorities, which includes state testing and academics. Previous research has found that even when administrators rank school health as a priority, academics will always take precedence. Other barriers include insufficient human resources, teacher turnover, and research fatigue. One facilitator that was mentioned by many of the stakeholders was finding the key staff. It has been known for some time that it is critical to have a school-based champion. We found that parent support specialists are a potential key staff member because they have access to a lot of the parents, which can help to increase recruitment. Also, recent studies underscore how critical it is to understand the inherent hierarchy within schools, emphasizing a systems-level approach, which includes gaining support at multiple levels, including superintendents, principals, nurses, teachers, and parents. Another facilitator to effective school-based research is reciprocity. Previous studies have also cited developing trustworthy relationships between partners and researchers using participatory approaches and improving follow-up procedures. One district administrator suggested that research and schools could work together for mutual benefit. This includes data sharing and collaborative dialogue as two effective methods for leveling the playing field and providing additional benefits to school districts. Communicating the benefits of a research project to school decision makers is a key factor for whether schools choose to participate in a study. The World Health Organization's Health Promoting Schools framework is an established approach for promoting health alongside traditional academics in schools. It provides confirmation of the need for school stakeholders to understand the importance of health promotion in improving academics. Another facilitator for teachers is the ease of use. Simple, adaptable, and easy to access materials are important. A recent study on program sustainability also reported the importance of making intervention components easy to incorporate into the current school schedule and structure. A challenge for researchers is finding a balance between accommodating teacher requests for short lessons while still achieving adequate dosage of the program and intervention. And finally, another facilitator for implementation or for school-based research at the teacher level is implementation support. This includes collaboration from other staff in training. Several of our stakeholders suggested that finding staff to implement a program outside of teachers would improve the success of the program. Teacher training is also correlated with increased teacher confidence, implementation fidelity, and program sustainability, making it an essential component for researchers to provide to partner schools. There are some limitations to acknowledge about our study. We had only women participants. There was one male PE teacher, but majority were women. We didn't have any information about single versus multiple parent households. This could change some of the potential barriers or facilitators to participation. We also didn't interview any principals. At the administration level, we only had district level administration. Future research can focus on looking at perspectives of principals as it might provide additional effective strategies for recruitment and engagement. And finally, we only focused on research and interventions in elementary schools. This is where the majority of the center's current research takes place. However, the processes and perspectives could be different if you were looking at either early care centers or secondary or high schools. So I'll end with some recommendations based on our research. So for researchers, consider intervention programs pre-K through 12th grade. Each grade has various testing requirements, and there are potential opportunities to engage with students at different levels. Intervention program activities and lessons should be short and simple to implement, available digitally and free. Also, we heard about that creating family-based programs is important. Report results back to schools in a timely manner. And finally, expand partnerships into diverse sectors. Recommendations for school recruitment and engagement. Knowing the district research recruitment process and policies was underscored often. Prioritizing relationship building throughout the process, both before a grant begins and after. Emphasizing the connection between health and academics. To encourage principal and administration buy-in. Identify key gatekeepers in each school and involve him or her in implementation and communication. And finally, designate a research coordinator to provide implementation support and monitoring. For teacher recruitment and engagement, we recommend reaching teachers in person at staff meetings and professional development, and also providing monetary incentives, free curricula, and/or classroom supplies. Recommendations for parent and child recruitment and engagement, including emphasizing the health and/or education benefits to the child of participation. If a program involves a whole family, providing childcare and food, communicating through multiple channels, and communication that is easily understood and disseminated in multiple languages. And finally, providing monetary incentives and/or connecting these incentives to program content to reinforce these messages. So in conclusion, input on systems level approaches for implementation of best practices for conducting research in the school setting. We want to also provide information about potential effective messages and communication channels for low-income and minority parents to improve participation. And this research also informs strategies for future research to maximize participation, improve program implementation, and creating sustainable relationships with districts, schools, and teachers. I'd like to acknowledge the co-authors on this project, Sarah Bentley and PI Dr. Deanna Helscher, and the entire community interview project team. This project was supported by the Michael and Susan Dell Foundation. And I'm happy to take questions at this time. All right, so one of the questions here in our chat box is, did we investigate the possibility of working with community-based organizations that may be established in schools already? That's a great question, and one of the questions that we asked with our schools was what programs and organizations they're already working with. So, because we don't want to recreate the wheel in a lot of these types of programs. So partnering with other community-based organizations was definitely an important component of improving recruitment and engagement. Another question we have was whether the research took place during the school year, which is also an interesting question. We, as we were recruiting for our study on recruitment, we also found some barriers in terms of timing. Some of the interviews did take place during the school year. However, the majority were during the summer, just because of competing priorities in terms of testing, especially in the spring. Another question we have is, they asked, I'm interested to know if you worked with any health science programs to improve outreach and interest in community research. For this project, we didn't, but there's definitely room for partnership with recruitment and engagement. Another good question was, you noted parents would like multiple avenues of communication. If you could only choose 2 or 3, which would they be? Which is a great question. Many parents said that handouts were probably the primary means of information. They also said that text messages are a really good way. We also heard from some of our parent support specialists who said that in person is probably the best way. It's not always feasible. However, especially if you're working with a parent support specialist, it could be a great way to reach parents. Another question was, were there any discussions about times of the school year that were more feasible for teachers or staff? While we didn't specifically ask any of the teachers or administration about times of the school year, at least here in Texas, there's a lot of testing in the spring, and so going in and working with schools in the fall is a good way to kind of avoid that testing time and avoid those competing priorities. Another question was asking about collaboration with PTAs, and that was definitely something that was mentioned by both parents and our administration as ways of kind of improving that in-person communication with parents. They mentioned especially working to get buy-in for the research, that working with the PTAs was an important group to get approval with the schools. Another question asked, is gaining permissions to text parents, teachers, or admin directly for research or to implement programs plausible? Does it depend on district policy or an individual agreement between researcher and subject? It's a great question, and a lot of it depends on district policies, because it's a lot of times it would be providing the phone numbers to the researchers, but also we would have to gain consent from the parents in order to send them text messages. So it'd be a combination of getting approval from the district for the research and also consent from each individual subject. Another question we have is, what was the follow-up to the internet contact? What was consideration of populations who did not have internet access? And that was a great question. We offered our parents, especially, the option of filling out the survey in person. So as we were scheduling our focus groups, we had the option of either online or in person while we're working there. Another question we have is, what about, how do you see the project aligning with STEM? Which is science, technology, I think engineering and math. I can't remember all of the, but aligning with other subjects. And that was a really important consideration for especially our teachers. They mentioned that aligning the health programs and the research with kind of the standards and the curriculum that they're already using is a really good way to improve kind of teacher uptake of health promotion programs, especially in the classroom. Another question is, what was the initial outreach effort to recruit parents? Was it just the internet? What about parents who never got an email because of lack of internet access? Recruiting parents, we went through our school contacts, and so at the schools that we were working with, they provided handouts. They also went through their parent support specialists to recruit the parents. So our main outreach to parents wasn't online. It was through the schools and through flyers, both hung up at the school and sent home with the children. Another question we have is, what was the demographics of the teachers who were involved with the outreach? Biology, education, physical education, health. The majority were classroom teachers, and because these are elementary school, they teach multiple subjects. We did have a few physical education teachers, but the majority were classroom. Another question is, were incentives provided for subjects to participate in this study? Yes, we did provide a gift card to all subjects who completed our interview or focus groups. Another question is asking about how long the focus groups were and where was it held. We held the focus groups at schools, and most of the time they lasted about an hour. Another question we have here is what are double-coded in reference to transcripts? So as we were going through the data analysis process, we would read through the transcripts, and as we would read people's responses to our questions, we would code them, meaning we would look at if someone responded that, oh, we can't participate in a program because I don't have any time, I have all these other things to do, we would code that as lack of time. And so we had two researchers who would go through each transcript to make sure that there was agreement on how we were coding. There's another question asking about how many school districts we used, and we used 5 different school districts, and because each district has their own research approval process, we wanted to make sure that we got a variety of perspectives from around around our area here. There's another question here looking at, did teachers or admin mention that summer planning sessions, such as the week before school starts, was an appropriate time to announce research or programs? We did have a few teachers that mentioned working with the districts in the summer was a good time. However, they also mentioned that sometimes because teachers or admin might be off during the summer, that sometimes it can be hard to communicate during those times. Another question was, did we do any outreach to faith-based organizations to improve the follow-up from parents? For this project, we didn't. However, we did have several parents and admin who suggested that partnering with community-based organizations and faith-based organizations would be a way to improve recruitment of parents. Another question is, in recruitment, did we consider the participation of families in food assistance programs? We didn't explicitly recruit families in food assistance programs. However, we did hear from several parents who were in food assistance programs and got their perspectives on several of the barriers and facilitators. Another question here is, do schools or principals always work well with the district? We have found some districts communicate with schools better than others, and some principals don't care what the district says. Did you have to balance that relationship to get buy-in from both? If so, how did you manage? That's a great question, and definitely something that we wanted to consider as we're working with both districts and principals. For this specific research, we didn't have any principals, which, as I mentioned, was a limitation. However, in talking with the school districts, they definitely mentioned that buy-in from the principals was one of the most important factors in effective research. There's definitely balancing. Working with the districts, we found that they just wanted to be included in the planning of research early in the process, and because they didn't want to be surprised by a big research project right before they submit like the the research application. But also we found that if there's a successful collaboration and relationship with the district, it's often easier to talk with principals, and oftentimes the district can help kind of facilitate that initial meeting with the principal to discuss a research project. Another question here is, what role can school nurses play or offer in assisting with research? We found that especially teachers mentioned that school nurses can be kind of that key staff member because they don't have a lot of the competing priorities of testing and academics, and because their main focus is health. Several schools mentioned that when doing the initial recruitment of schools to reach out to school nurses as potentially that kind of key gatekeeper into the schools. Another question here is, what is the mechanism to provide these results to community-based organizations who have more direct connections to intervention methods? Well, this webinar is one of our key dissemination routes. We've also been providing these results back to the school districts who we're working with, and have been providing and asking for input on other partnerships that we can use this information to help engage. Another question is, what is the connection of this research to social determinants of health? Will this outcome be conveyed to municipalities and public health agencies? One of the key themes of this research in looking at barriers and facilitators was looking at barriers of parents to participating, and many of the parents mentioned that lack of resources, including transportation, childcare, were big barriers to participating in health promotion or health-related research. And so by ensuring that we're addressing some of these barriers when we're planning and implementing health programs, we're hoping to, while the research doesn't necessarily directly address other social determinants of health, we're trying to take them into consideration to improve engagement. All right, and I think that's about all the questions. My email is listed on the screen, so I'm happy to answer any other questions you may have about any of this research through email. I want to thank everyone for listening today, and I'll hand it back to Veronica.
Thank you, Leanne. And like I said earlier, this webinar is being recorded and will be archived on msdcenter.org. Thank you, everybody who came to listen. Thank you.